Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Mr. Chairperson. Thank you all for giving me this chance to be here with you today. My name is Mohammad Alawad. I will be presenting our latest project. Nasser is here with me. Saad is still in Riyadh. Our project is a retrospective cohort study on unstable thoracolumbar burst fractures. We are questioning whether to fix with single level or two-level posterior spinal fixation. Disclosure, we have nothing to disclose. Introduction, just a bit of introduction. Thoracolumbar junction is the vertebrae between T11 and L2. Thoracolumbar fractures are common in Saudi Arabia, and by far the most common mechanism of injury is motor vehicle collisions. Types of fracture are classified by more than one method or one system. AO system is a bit more inclusive to classify these fractures. And among these fractures, base type, which is a subtype from compression fractures, the first one, type A, is the most common. The current practice, relying more on saving more motion segments, which is like a principle of surgery for spinal fractures in general. And with the introduction of pedicle screws, shorter segment fixation, like with the introduction of pedicle screws, which is like more provides more strength than the previously used techniques. Shorter segment fixation was a bit of a good option once these screws were introduced compared to a long fixation. Goal of this study, our goal was like whether we're able to provide a clear-cut evidence for the management of single-level thoracolumbar fractures, burst fractures, and therefore, if we can reduce the economic burden for both the patient and the healthcare system, our aim was to assess the loss of kyphotic, the loss of correction measured with kyphotic angle in patients with single-level unstable burst thoracolumbar fractures who underwent posterior spinal fixation. The purpose of this study was to see the difference between one level and versus more than one level, as we said before. Study setting and design. This is a retrospective cohort study. Were carried out for those patients who had a single-level thoracolumbar burst unstable fracture between the period of August 12 until July 2015, and it's only those who underwent posterior spinal fixation at our institution. We all work at King Saud Medical City, which is a major trauma center. It's a tertiary center in the capital of Saudi. Provides healthcare services to all individuals with no exceptions. It's by far the largest trauma center. It's by far the largest orthopedic department in terms of bed capacity. So digging more into our study, our inclusion criteria was those adult patients, so like we include the 18-year and old and above. We only had those with single level unstable burst thoracolumbar fractures. We included only those with no other adjacent spinal injuries. We excluded all those who had 2 or more spinal fractures. We excluded all those who had fractures within the follow-up time, which was a 1-year time. Data collection. So as we were assessing 2 kind of techniques, pure surgical techniques, so we targeted the operating room's record. So we asked for all those patients who underwent posterior spinal fixation between the study, like between the 3-year study period. And we identified those who had thoracolumbar fractures, and subsequently we identified those who had unstable burst. Primary exposure was the single level posterior spine fixation, and the comparative group were the two levels or more, whether above the fractured vertebra or below the fractured vertebra. Primary outcome was the difference between the mean difference between the lost kyphotic angle at the 1 year minus the immediate post-op. Statistical significance between the two means were assessed using t-test, and difference between categorical variables versus chi-square. We identified p-value of less than 0.05 as significant, and we used SAS. Going to results, which is alarming, it's 17 seconds now. Going to results, like we had 374 patients with thoracolumbar fractures, and of these, we had 103 patients who had unstable burst thoracolumbar fractures. 4 were excluded for having adjacent vertebral fractures, and 39...
You have 2 extra minutes. Please resume.
Thank you, Mr. Chairperson. And 39 completed their 1 year follow-up. And these are our results. As we said, we had 39 patients. We really struggled with one single level fixation. We found that a lot of surgeons have stopped doing single level, so that's why it's only 10 patients who underwent single level posterior spine fixation compared to more than that. We had almost 3 to 1 male to female incidence rate. L1 fracture were the most fractured vertebra. We had somehow we found that in terms of fusion and decompression, it was not we did not find a clear cut between the two techniques. Going to our ultimate assessed results, which was the difference in kyphotic angle. We took the mean of the difference in kyphotic angle at 1 year minus, as we said, minus the immediate post-op, and we found that those who had more than 1 level fixation had less loss of the correction, and we found that to be statistically significant. Conclusion: 2-level posterior spine fixation was superior to 1-level posterior spine fixation in terms of maintaining the kyphotic angle. This is by far the first study intended to provide a clear cut in terms of for the management of single-level thoracolumbar fixation in terms of maintaining the kyphotic angle. We really advise for future prospective projects just to assess other parameters, whether the pain, whether disability improvements, speed of recovery, and that's all. Thank you very much.